Good morning. Now we'll be discussing about the gross anatomy and joints of the vertebral column, which is very important. So vertebral column is a part of axial skeleton, and vertebral column consists of vertebrae in which the notochord is found in all chordates has been replaced by segmental series of bone. Vertebrae are separated by the intervertebral. The vertebral column is also known as spine or spinal column or backbone. It's composed of series of bones called vertebrae. Singular is vertebra. About 71 centimeters in length in adult male and about 61 centimeters in adult female, the length of the vertebral column. Spinal cord is around 42 centimeters in male and 40 centimeters in female. The functions of the vertebral column: supports the head, helps to maintain the balance in upright position, encloses and supports and protects the spinal cord, permits the movements, absorbs shock during walking, serves as a point of attachment for the ribs, pelvic girdle, muscles of the back and pectoral girdle and upper limb. The total number of vertebrae during early development is 33. As the child grows, several vertebrae in the sacral and coccygeal region fuse. Finally, in adults, we have 26 vertebrae. Sacrum and coccyx bones become fused. That means we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacral fusion of 5 sacral vertebrae to form 1 sacrum, and coccyx is also a fusion of 3 to 5 coccygeal vertebrae. Sacrum and coccyx do not have any. The cervical, thoracic and lumbar vertebrae are mobile. Sacrum and coccyx are immobile. Between the adjacent vertebrae from second cervical vertebrae to the sacrum are intervertebral discs. Inter means between. Intervertebral discs are fibrocartilaginous structures. General structure of vertebral column. 7 cervical vertebrae. The importance and features, special features are presence of foramen transversorum. 12 thoracic vertebrae, the special features, they articulate with 12 pairs of ribs. 5 lumbar vertebrae, 5 lumbar plus 7 cervical is 12 thoracic. 1 sacral vertebrae is formed by the fusion of 5 sacral vertebrae. 1 coccyx is formed by the fusion of 3 to 5 coccygeal vertebrae. So general structure of vertebrae, which you have all gone through it. It has a body, a single spinous process, a pair of laminars, a pair of superior articular processes, a pair of transverse processes, and pedicles which connect the body with the transverse process. So paired are the laminar, superior articular facets. We also have inferior articular facets, pedicles and transverse processes. General structure of cervical vertebra. Cervical vertebra is 7, framed to form the neck region and support the skull. Cervical vertebra are small in size, and the most important feature of cervical vertebra is presence of the transverse processes. Foramen in the transverse process. General structure of thoracic vertebra. Thoracic vertebra is 12, forms the posterior part of the thoracic cage. Articulates with the associated. Unique feature of the thoracic spine. Articulations between the vertebra and the ribs are unique in the thoracic vertebra. For each rib, there are two separate articulations, and these articulations are known as costovertebral and costotransverse articulations. The head of the rib articulates with the demifacets on the body of the thoracic vertebra. The tubercle of the rib articulates with the costal facet present on the transverse process of the thoracic vertebra. General structure of the lumbar vertebra. They form a skeletal support to the posterior abdominal wall, characterized by the large size. 5 lumbar vertebrae situated between the thoracic vertebrae and the sacral vertebrae in the spinal column. They are the largest and heaviest vertebrae in the spinal cord, able to support the weight of the body when the person is standing. Sacral vertebra is formed by the fusion of 5 sacral bones. They are immobile and it's related to synostosis. Sacrum articulates 1 with the 5th lumbar vertebrae, that is lumbosacral joint, articulates with the 2 pelvic bones, and that is the sacroiliac joint, and inferiorly it articulates with the coccyx, that is sacrococcygeal joint. So sacrum articulates with 4 important joints, 2 sacroiliac joints, superiorly lumbosacral joint with the lumbar vertebra, 5th lumbar vertebra, and inferiorly with the coccyx, that is sacrococcygeal joint. It forms the posterior wall of lower abdominal and pelvic cavity. Coccyx is formed by 3 to 5 coccygeal bones. It is also immobile and its synostosis forms the lower part of the pelvic cavity. These are the major important differences between the sacrum and coccyx. Sacrum is formed by the fusion of 5 sacral vertebrae. Coccyx is 3 to 5. Sacral articulates with 5th lumbar vertebra, iliac bones and coccyx. Coccyx articulates with the 5th sacral vertebra. The main function of sacrum is weight transfer, okay, and coccyx has few muscles and ligaments. Sacrum has a body, sacral canal and sacral foramen. These are the major important differences between the cervical vertebra, thoracic vertebra and the lumbar vertebra. So normal vertebral curvatures. Normal vertebral curvatures are the primary curvatures which develop in the fetal period. That is the thoracic region and in the sacral region. They are kyphotic. Secondary curvatures result after the extension from the flexed fetal position, that is in the cervical region and lumbar region when the baby starts walking or standing. Cervical region and lumbar region are the second curvatures. So normal vertebral curvatures are 4. Primary are thoracic and sacral. Secondary are cervical and lumbar. Primary appear during the fetus. So in the fetus period, there is a single curve. At 3 months after the birth, when the infant's head starts beginning to crawl, the cervical curve develops. When the child sits and stands and walks, the lumbar curve develops. So primary curvature is C-shaped. When the baby is first born, his spine will have a convex curve and shape of a letter C. The spinal alignment is called the primary curve and it develops in the utero. The newborn does not have muscle strength to hold up the head and it needs to be carried carefully. Secondary curvature is a cervical curvature. Over the first few months after the birth, when the baby will begin to interact with the world around, he will lift his head and look around and turn to direction, to the noise and light and catches his attention. It is then he develops the muscles of the neck and develops a secondary curve in the upper spine, or that is known as a cervical. Final curve is a lumbar curve. Develops when the low back and it's called the lumbar curve. It starts developing when the baby begins to creep and crawl, and lumbar curve provides proper postural alignment. He or her spinal development between 12 to 18 months and when he masters walking up. This is the C curve when the baby is newborn. It has to be held. So normal curvatures of the vertebral column are 4: cervical, thoracic, lumbar and sacral. Cervical and lumbar are convex. Thoracic and sacral are concave, and they are the primary curvatures. Cervical and lumbar are the secondary curvatures. So you look into the vertebral column, the primary curvatures, they are concave anteriorly or kyphotic, or convex posteriorly. They are present. They are the thoracic and in the sacral curvatures, which are primary curvatures. Secondary curvatures develop after the birth. They are convex anteriorly. They are present in the cervical and in the lumbar region. Cervical when the child holds up its neck, and lumbar curvature develops when the child starts walking. So curvatures of the vertebral column in adult presence: cervical, which is a secondary curvature; thoracic is the first primary curvature; lumbar is the secondary curvature; and the sacral is a primary curvature. These curvatures are classified therefore as primary and secondary. Curvatures help to align our body's center of gravity and provide shock absorption throughout the walking cycle or gait cycle. So abnormal curvatures: scoliosis, abnormal lateral curve more than 10 degrees, abnormal kyphosis or hunchback, exaggerated thoracic curve or hump disease, lordosis, accentuated lumbar curve bent backwards, commonly seen during pregnancy. Vertebral foramen contains the spinal cord and its roots, spinal meninges, anterior spinal artery, posterior spinal arteries, venous plexus and fat. Vertebral foramen of all vertebrae form the vertebral canal or the spinal canal. Intervertebral foramen or the neural foramen between each pair of vertebrae are two apertures. Intervertebral foramen formed by the superior and inferior vertebral notches. It allows the passage of nerve roots. Abnormalities of the vertebral canal, that is the spina bifida. So movements of the vertebral column, there is a wide range of movement in the regions, and individual mobility is also present, and this is mainly due to the elasticity of the intervertebral disc. Normal range of movement is reduced to 50% or more as a result of aging. The vertebral movements are flexion, extension, lateral flexion, rotation, circumflexion. So these movements are formed at various joints of the vertebral column. Cervical region, we have flexion, extension, lateral flexion, mainly at atlanto-occipital and atlanto-axial joints. Thoracic, the movements are restricted because of the attachment of the ribs. Only minimum rotation occurs in the thoracic part of the vertebra. Lumbar, again we have wide range of movements just like the cervical region: flexion, extension and lateral flexion. Sacral, because of the fusion, there is no movements in the sacral part of the vertebra. So vertebral column is composed of 33 vertebrae and 23 intervertebral discs divided into 5 regions: the cervical region, the thoracic region, the lumbar region, the sacral region and the coccygeal regions. The joints of the vertebra are mainly 8 important joints: atlanto-occipital joint, atlantoaxial joints. These two joints are craniovertebral joints. Intervertebral joints between the two vertebrae. Then we have costovertebral joints and costotransverse joints. These are related to the thoracic vertebra, where the ribs articulate with the body of the vertebra and transverse process. Lumbosacral joints are between the fifth lumbar and the first sacral vertebra. Sacroiliac joints between the sacrum and the iliac bones. Sacrococcygeal joint is between the fifth sacral vertebra and the first coccygeal vertebra. There are three intervertebral joints. A typical vertebra has 6 joints. 1. 4 synovial joints, 2 above and 2 below, a pair between the facets of adjoining vertebral arches. These are zygofacial joints or facet joints between the superior articular facets and inferior articular facets. Second is 2 symphyses between the vertebral bodies, one above and one below. That includes the intervertebral disc. Each adjacent vertebra from axis to the sacrum. Present, we have the intervertebral disc. Facet joints are the superior and inferior between the superior articular facets and inferior articular facets. The intervertebral joints, that is between the bodies, is symphysis, that is between the body, upper part of the upper vertebral body, the lower vertebral body and the intervertebral disc. These are the joints between the vertebral bodies. Joints between the facets and joints between the vertebral body. So, joints of the vertebral column is symphysis between the vertebral bodies, one above and one below and in between the intervertebral disc. Synovial joints between the articular processes, that is superior articular facets and inferior articular facets. So totally we have 6 joints between the two vertebrae. So we have the craniovertebral joints, which are the atlanto-occipital joints and atlanto-axial joints. Costovertebral joints are related to all the rest of the vertebra. There are 2 costovertebral joints which is related to the thoracic vertebra, costovertebral and costotransverse joints, and joints between the bodies. The movement that can occur between the vertebra are flexion, extension, lateral flexion and rotation. In the intervals between the occipital bone, atlas and axis, where there is so much of movement, that is because there is no disc and they are mainly synovial joints. Sacroiliac joints are also immobile joints. They are considered to be weight-bearing joints. Joints between the two vertebrae are cartilaginous joint. The upper and the lower surfaces of the bodies of adjacent vertebrae are covered by thin plates of hyaline cartilage. Sandwiched between the hyaline cartilage is an intervertebral disc of fibrocartilage, joint between the bodies, between the upper and lower surfaces of adjacent vertebra is lined by hyaline cartilage, and between the hyaline cartilage is a fibrocartilage, which is the intervertebral disc. So joints of the vertebral cartilage, joints of the vertebral bodies are symphysis or secondary cartilaginous joint designed for weight bearing and strength. The articular surface of the adjacent vertebra are connected with intervertebral discs and ligaments. The intervertebral disc consists of outer annulus fibers and surrounded by a central nucleus pulposus. Intervertebral disc consists of outer annulus fibrous and central nucleus fibrosus. Intervertebral discs, the main function are shock absorbers. They are strong but undergo degeneration with the age. It begins at about the age of 20. Intervertebral joints, that is from C2 to C5 spinal vertebrae articulates. They permit small movements associated with flexion, extension and rotation. Intervertebral discs are pads of fibrocartilage separate the two vertebral bodies. Intervertebral ligaments bind the vertebra together and stabilize the vertebral column. Intervertebral disc is present only between the adjacent vertebrae, that is from C2 to sacral vertebra, second cervical vertebra. No intervertebral disc between C1 and C2. The most inferior intervertebral disc is between L5 and S1. Movable vertebrae articulate also with articular facets. They are the facet joints. Left and right superior articular facets articulate with the vertebra above. Left and right inferior articular facets articulate with the vertebra below. Joints of the vertebral arches are zygofacial joints or facet joints. They are plain synovial joints between the superior and inferior articular vertebra. Accessory ligaments unite the laminar, transverse process, spinous process and stabilize the joints. They are all these joints between the facets, superior and inferior synovial joints. The ligaments of the vertebral column. The most important ligament is the anterior longitudinal ligament. It binds the anterior surfaces of the body. Posterior longitudinal ligament binds the posterior surface of the body. Ligamentum flavor is related to the lamina and it attached to the two lamina. Then we have the supraspinous ligament which connects the tips of the spinous process, interspinous ligament and intertransverse ligament. Interspinous ligament is between the spinous process and intertransverse ligament. So coming to the detailed parts of the ligaments of the vertebral body and joints. The two ligaments which strengthen the vertebral body are the anterior and posterior longitudinal ligaments which run the full length of the vertebral column. Anterior longitudinal ligament is thick, prevents hyperextension of the vertebral column. Posterior longitudinal ligament, which is related to the posterior surface, is weaker and prevents hyperflexion. Anterior longitudinal ligament connects the anterior surface in full length of the vertebral column. Posterior connects the posterior surface of the vertebral body. The other important ligaments are the ligamentum flavor, which connects the lamina of the adjacent vertebra. Interspinous ligaments, they connect the adjacent spinous processes. Supraspinous ligaments run between the tips of the adjacent spines. Intertransverse ligament runs between the adjacent transverse. Now coming to the joints of the vertebral column. Craniovertebral joints. The atlanto-occipital joint between the atlas and the occipital condyle. Atlanto-axial joints is between the atlas and the axial joint. They are synovial joints with no intervertebral disc and there is a wide range of movement than the rest of the vertebral. Atlanto-occipital joint, superior articular facets with the occipital condyles. The main important is the movement is flexion, that is the head S movement. Flexion with lateral flexion. Atlantoaxial joints are the right and left lateral atlantoaxial joints and medial atlantoaxial joint. Medial atlantoaxial joint is an example of pivot joint. The lateral atlantoaxial joints are the plane joints. The movements at atlantoaxial joints where the cranium and atlas rotates on axis as a unit, and this movement is rotation of the head and mainly related to the side to side movement, or it is no movement. The important ligaments related to this craniovertebral joints are superior and inferior longitudinal bands, apical ligaments, alar ligament, cruciate ligament of atlas, and membrana tector. Now coming to the costovertebral joints, which are mainly related to the thoracic vertebra. The bodies of vertebra with the head of the rib, the transverse process of the related vertebra with the tubercle of the rib. These movements are slight gliding movements essential for altering the volume of the thoracic cavity during. So articulation of vertebral column with the vertebra 1 is costovertebral joints, the head of the rib with the bodies of the vertebra, the costo-transverse joint, the rib with the transverse process, that is the tubercle of the rib with the transverse process. The head of the rib articulates with two adjacent vertebrae, inferior costal facets of the superior vertebra and superior costal facet of the inferior vertebra respectively. Costotransverse joint articulates with the tubercle of the rib with the reciprocal facet on the transverse process of the corresponding vertebra numerically. Costotransverse joint is a typical synchondrosis type and slight gliding movement is coming to the joints of the sacrum. Sacrum has four important joints. 5 of course. Anteriorly, pubic symphysis, a cartilaginous joint. Posteriorly, two sacroiliac joints, that is synovial joints, that is laterally. Posteriorly, sacrococcygeal joint, that is inferiorly. And posteriorly and superiorly, lumbosacral joints. So, sacrum articulates mainly with 4 joints. 2 are bilateral joints. Anteriorly, pubic symphysis. Posteriorly above lumbosacral joints, posteriorly and inferiorly sacrococcygeal joint, and posteriorly laterally are two sacroiliac joints. Anteriorly pubic symphysis and posteriorly sacrococcygeal joints are cartilaginous joints, whereas posterior laterally is a synovial joint and posterior above lumbosacral is the symphysis joint. Lumbosacral and sacrococcygeal joint, although joints of axial skeleton, are directly related to the pelvic girdle and strongly supported by strong ligament cartilaginous joint between the left and right superior rami of the pubic bone. It consists of fibrocartilage, interpubic disc surrounded by ligaments united by the bodies of the pubic bone in the midline. So it is the two pubic bones are lined by hyaline cartilage and bounded by the fibrocartilage interpubic disc. Interpubic disc is wider in females. Abnormal symphysis pubis or dysfunction. Abnormal gap in the symphysis pubis. This is known as diastasis symphysis pubis. It is a separation of normal joint pubic bones without a fracture. Separation of symphysis pubis occurs spontaneously in at least 1 to 800 vaginal deliveries. It is usually noticed after delivery and it has been associated with forceps delivery. Symphysis pain aggravated by weight bearing and walking and waddling gait. Pubic tenderness and palpable interpubic gap. Sacroiliac joints. These are bilateral sacroiliac joints, the sacrum articulates with the iliac bone. It's a strong weight-bearing compound joint with limited mobility. It has an anteriorly a synovial joint between the ear-shaped articular facets of sacrum and ilium. Posteriorly, it is syndesmosis between the tuberosities of the same bone. The joint is strong, supports the entire weight of the part of the body. The important ligaments related to sacroiliac joints are anteriorly anterior sacroiliac joints, posteriorly sacroiliac joints, and in between the joints we have strong introitious sacroiliac ligaments. So anterior sacroiliac ligaments, posterior sacroiliac ligaments, and in between the two bones is introitious sacroiliac ligaments. Introitious sacroiliac ligament is the primary structure involving in transferring the weight of the body from the lower limbs to the axial skeleton. Coming to the lumbosacral joint. The lumbosacral joint is a joint of the body between the last lumbar vertebra, that is the fifth lumbar vertebra, and the first sacral segment of the vertebral column. It is mainly bounded by the iliolumbar ligaments. Iliolumbar ligaments extend from the transverse process of L4 and L5 to the iliac crest. The lumbosacral joints are lumbosacral symphysis or the secondary cartilaginous joint, articulation between the fifth lumbar vertebra and first sacral vertebra. Similar to the other joints of the vertebral column, lumbosacral joints have two separate articulations. One, the anterior intervertebral joint, symphysis joint, formed between the vertebral bodies of L5 and S1, separated by a large intervertebral disc and connected by vertebral ligaments. Second is the facet joints, the two zygofascial joints between the articular processes of the L5 and S1. These are synovial joints. The important movements of the lumbosacral joints is flexion by rectus abdominis, internal and external obliquus muscle. Extension is the erector spinae group of muscle. Rotation is external and internal obliquus muscles alternating. Sacrococcygeal joint. Joint with secondary cartilaginous joint with intervertebral disc. The fibrous cartilage and ligaments join the apex of the sacrum with the base of the coccyx. It also presents anterior and posterior sacrococcygeal ligaments, which reinforce the joint. So sacrococcygeal joint is also a secondary cartilaginous joint with minimal mobility. Moderate degree of forward and backward movements. But however, they are fixed joints. So these are the major important differences between the male pelvis and female pelvis, which you have to know thoroughly. It continues in the second slide also. The main important differences between male and female pelvis. Very, very important. Usually they'll ask you to write about 8 to 10 important differences. These are figures related to male and female pelvis. The inlet, outlet, the cavity, the pubic arch is very important, which is a main difference between the female and male pelvis. So the important movements in the cervical vertebra is flexion, extension, hyperextension, rotation and lateral flexion. Thoracic region, the movements are very minimal because they are attached to the ribs, slight rotation and minimum lateral flexion. Lumbar, again we have wide spread of movements, flexion, extension and hyperextension. Sacral and coccygeal. The movements are very restricted because of the fusion of sacral vertebra and coccygeal vertebra. So overall the movements of the vertebral column is flexion, extension, lateral flexion, rotation. Putting all these movements together is circumflexion. So flexion, the main muscles causing the flexion, and the movements are more well appreciated in the cervical and lumbar region. Flexion, longus cervicis, scalene, sternocleidomastoid, rectus abdominis of both the sides, extension of the vertebral column, that is straightening mainly the erector spinae group of muscles and transverse spinalis group of muscles. Lateral flexion, longissimus, iliocostalis and obliquus muscle of abdominal wall. Rotation is by the rotators and the multifidus. Circumduction is limited assertion of movement by the preceding movements. So overall the movements of spine, mainly the muscles contributing for extension of the thoracic and lumbar region are the erector spinae group of muscles and transverse spinalis group of muscles, that is semispinalis, multifidus, and also we have intertransverse and levator costrum. So these are the various movements of the vertebral column. We have flexion, extension, lateral flexion and rotation. Coming to the applied aspect, prolapse and degeneration of the intervertebral disc, dislocation of vertebra, mainly the cervical region, violent rotation, fractures of the dens, severe kyphosis, scoliosis, lordosis, complete or incomplete brachiosis, that is non-fusion of the vertebral arches, cervical rib syndromes, lumbar rib syndrome, sacralization, symptomatic vertebral hemangiomas, spondylitis common in cervical and lumbar vertebra, lumbar spinal stenosis, cervical fusion between C5 and C6, accidents, that is spinal cord injuries. So with this we complete the gross anatomy of vertebral column and the important joints of the vertebral column. Thank you very much.